What if healing from cancer was not only about fighting the disease, but also about supporting the body, the mind, and the systems that allow treatment to work better? Every year, millions of people hear the word cancer, yet very few truly understand what is happening inside their body, or what they can realistically do to support themselves during treatment. Today, leading cancer doctors and researchers explain, in clear and science-based terms, how patients can actively support their healing journey without false promises, fear, or misinformation. This is not about miracles. This is about understanding cancer, understanding treatment, and understanding how small, evidence-based choices can make a meaningful difference. What is cancer? A simple, scientific explanation. At its most basic level, cancer is a disease of uncontrolled cell growth. The human body is made up of trillions of cells, and under normal conditions, these cells grow, divide, and die in a highly regulated and precise way. This regulation is controlled by genetic instructions inside each cell, along with signals from the surrounding environment. Cancer begins when certain cells lose the ability to follow these normal control mechanisms. Instead of stopping when they should, they continue to grow and divide. Over time, these abnormal cells can accumulate and form what is known as a tumor. Not all tumors are cancer. A cancerous or malignant tumor has the ability to invade nearby tissues and, in some cases, spread to distant parts of the body through the blood or lymphatic system. This process is called metastasis and is one of the main reasons cancer can become life-threatening. Cancer can develop in almost any part of the body because cells exist everywhere. In women, breast cancer is one of the most common types. In men, prostate cancer is highly prevalent. In both men and women, lung and colorectal cancers are among the most frequently diagnosed worldwide. Why every cancer is different. One of the most important things doctors emphasize is that cancer is not a single disease. In fact, there are more than 200 different types of cancer, each with its own biological behavior. Even within the same cancer type, such as breast cancer, tumors can be vastly different from one person to another. A breast tumor in one patient may grow slowly and respond well to hormone therapy, while another may behave more aggressively and require a completely different treatment approach. This is because cancer cells themselves are not identical. Within a single tumor, there may be multiple subtypes of cancer cells, each with slightly different genetic mutations. Some of these cells may be sensitive to treatment, while others are more resistant. This biological diversity explains why cancer treatment is complex and why therapy must be individualized. It also explains why a tumor may shrink significantly with treatment, but not disappear entirely, because different cell populations respond differently. Understanding cancer, staging, and why it matters. When a person is diagnosed with cancer, one of the first things doctors determine is the stage of the disease. Staging provides information about how much cancer is present and how far it has spread. Doctors look at several factors: the size of the primary tumor, whether cancer has spread to nearby lymph nodes, whether it has spread to distant organs. Staging helps guide treatment decisions and provides insight into prognosis. Importantly, staging is not a measure of hope or worth. It is a clinical tool used to choose the most appropriate therapy. Early-stage cancers may be treated with surgery alone, while more advanced stages often require combinations of therapies. The three main pillars of cancer treatment. Modern cancer treatment is built on three primary medical therapies: surgery, radiation therapy, and chemotherapy. Each works in a different way and serves a different purpose. Surgery physically removes the tumor and, when possible, surrounding tissue to ensure cancer cells are eliminated. Radiation therapy uses high-energy X-rays or particles to damage the DNA of cancer cells, preventing them from dividing and causing them to die. Chemotherapy uses drugs that target rapidly dividing cells. Because cancer cells divide more frequently than most normal cells, they are particularly affected. However, some healthy cells, such as those in the hair follicles, digestive tract, and bone marrow, can also be affected, which explains many side effects. Doctors carefully balance these treatments to maximize cancer cell destruction while minimizing harm to healthy tissue. Why side effects happen and how they are managed. Side effects are not a sign that treatment is failing. They are often a sign that therapy is doing exactly what it is designed to do. Targeting rapidly dividing cells, fatigue, nausea, pain, changes in appetite, anxiety, and depression are common during cancer treatment. Leading oncology centers now recognize that managing these effects is not optional, it is essential. Supporting patients through side effect management improves quality of life, treatment adherence, and overall outcomes. This is why modern cancer care increasingly focuses on treating the whole person, not just the tumor. Integrative oncology, supporting the whole patient. Integrative oncology combines conventional cancer treatments with evidence-based supportive therapies. This approach does not replace medical treatment, it complements it. Examples include nutrition counseling to support strength and energy, physical activity programs adapted to treatment stage, acupuncture for pain and nausea management, psychological support for anxiety, depression, and emotional stress. Scientific research shows that addressing physical and emotional well-being can help patients tolerate treatment better and recover more effectively. The role of nutrition in supporting healing nutrition plays a critical role during cancer treatment, but it must be approached carefully and scientifically. There is no single anti-cancer diet. However, adequate nutrition supports immune function, tissue repair, and energy levels. Many doctors emphasize the importance of maintaining body weight and muscle mass during treatment, especially for patients undergoing chemotherapy or radiation. In general, nutrition strategies focus on adequate protein intake, whole, minimally processed foods, sufficient calories to prevent malnutrition, hydration. Any dietary changes, including fasting or supplementation, should be discussed with the oncology team to ensure safety and appropriateness for the individual patient. Intermittent fasting. What science currently says. Intermittent fasting has gained attention in cancer research, but doctors stress that it is not suitable for everyone. Some early studies suggest fasting may influence metabolism and cellular stress responses. However, clinical evidence in cancer patients is still limited, and fasting may be harmful for individuals who are underweight, malnourished, or experiencing treatment-related fatigue. For this reason, responsible doctors emphasize that fasting should never be done without medical supervision, especially during active cancer treatment. Mental and emotional health, a critical part of healing. A cancer diagnosis affects more than the body, it affects the mind. Anxiety, fear, uncertainty, and depression are common and understandable reactions. Research shows that psychological support can improve coping, treatment adherence, and quality of life. Mindfulness, meditation, counseling, and stress reduction techniques can help regulate the nervous system and improve emotional resilience. Supporting mental health does not cure cancer, but it helps patients navigate the journey with greater stability and strength. The promise of precision medicine. One of the most exciting developments in modern oncology is precision medicine. Through genomic profiling, doctors can analyze the specific genetic mutations driving a patient's tumor. This information allows clinicians to select targeted therapies that are more likely to work for that individual cancer. Treatments that once seemed impossible are now becoming available because therapy can be tailored to the tumor's unique fingerprint. While not every patient is eligible for targeted therapy, the field continues to expand, offering hope grounded in science rather than speculation. What patients can realistically do to support their healing. Top cancer doctors consistently emphasize the following evidence-based actions. Stay informed using reliable medical sources. Maintain open communication with the healthcare team. Follow prescribed treatments carefully. Support the body with proper nutrition and hydration. Address side effects early, not silently. Prioritize rest and gentle movement when possible. Seek emotional and psychological support. Healing is not about control. It is about partnership between patient, body, and medical science. Hope rooted in reality. Today, cancer treatment is advancing faster than ever before. Therapies that did not exist even a decade ago are now improving survival and quality of life for millions of patients. Hope does not come from denying the seriousness of cancer. It comes from understanding it, respecting it, and using every evidence-based tool available to support healing. Knowledge empowers patients. Science protects patients. Compassion sustains patients. If this video helped you better understand cancer and how patients can support their healing in a science-based, responsible way, please consider subscribing to the channel. Here, we share educational content, real expert insights, and supportive resources designed to inform, comfort, and empower patients and families facing cancer.